Stay tuned now to take charge of your health. Take charge of your health. Coming up, it's 4 p.m.
Hi, this is Take Charge Your Health with Kareem Fernari, clinical nutritionist, physician assistant, and Carol Peterson, pharmacist. Listen, learn, and I hope you enjoy the show. Bye.
Welcome back. This is Take Charge of Your Health with Corrine Fernari, clinical nutritionist and physician assistant, and my co host, Carol Peterson, pharmacist. Every week, we present you with new and creative ways to help you make sense of health information and bring it home to you and your family. With years of clinical experience between us and research into traditional and cutting edge technologies, we give you practical information to help you take charge of your health. Welcome back. Welcome back. I'm here with my co host, but we also have a very special guest. Hi, Carol.
Hi. Hi. I'm just texting away. We're trying to get our guests on, and I think Reggie's going to try to get that accomplished in a few minutes.
Okay.
So,
Very hopefully sooner than later. It's
okay.
always it's always a challenge. I always start out the show with a plan in my mind, and then something gets mixed up, and I have to focus on totally something different to be able to get this going. But what we have today is I think, a very special show. Dr. David Brownstein will be here with us when he connects in. He is a very well known holistic doctor. He's a practicing doctor. He has a clinic as well. He has written over 16 books, all focused on two levels. One, sharing information with practitioners, but it is written up in just a way that lay people can read it, understand it, patients can read it, understand it, and incorporate the knowledge into their lives, into their health protocols. That's that's quite a talent to be able to synthesize the information and get it put together. It's very impressive, and especially 16 books. But Dr. Brownstein is one of the reasons why we, all of the practitioners all across the country, he and Dr. Abram Hoffer, uh, is how we understand the importance of iodine. Now, iodine in the 1970s, we realized that iodine was there was a what they call a goiter belt. There was a whole area that has very low iodine, and you would see people with very large goiters. There were lots of miscarriages and lots of health problems associated with the low iodine. So the government stepped in and started putting a very low amount of iodine in the salt. Well, that was in 1970. They put 150 approximately per amount that you would use in a daytime. They put 150 micrograms in the salt. And what happened? The goiters went away. They literally, um, that health problem was resolved. But the thing that happened was that many of the other health problems, a total understanding of iodine was not resolved. And so here we are using trace doses to get a minimal effect without the understanding of the depth of this mineral and what it does for our bodies. Carol?
I
Dr.
think
Brownstein.
we have Dr. Brownstein now, right? Can you speak?
I'm here if you can hear me.
Oh, yeah,
Yes, perfect.
perfectly. Welcome.
Perfectly.
Can I say one thing, Dr. Brownstein? When we were on the radio not many, but quite a few times, particularly right around at the beginning and during COVID, we would call on you to assist us. Well, you gave a protocol. You were being harassed because you were not able, nobody was able to say that there was help for COVID, there was support for COVID, but you gave a protocol. And I took that protocol, typed it up, and sent it out in a newsletter. I got a I got an email back from a chiropractor in California who I didn't know. And what he said was, "Thank you so much. You saved my cousin and one of my patients' lives. They were right on the edge. We really thought we were losing them. I got the newsletter and I was able, and without even questioning it, I implemented it and it turned them around within a few days. So I want to give you the credit. I took it at that time, but I wanted to give you the credit and thank you for your innovation and your the unique but very special way that you have of one looking at health, but number two, sharing it with people so they can implement it in their lives.
Well, thank you for that lovely story. That makes me feel good. And um, you know, COVID was a scary time, and it was just we weren't worried about it in our office because we knew how to treat viral illnesses holistically, and we just uh, treated it like it was another coronavirus, and our patients did fine with it overall. And you know, let's move on. Hopefully, as a country, we can move on and not get caught in the fear again from that nonsense. Because we have enough knowledge to treat viral illnesses. We shouldn't be locking the country down and mandating ineffective toxic therapies and masking and all that stuff.
Hooray, I hope we've seen the last of it. I
So,
just, I don't think quite so. I see people walking around with masks still some of the
oh,
time.
Did you
sometimes, yes.
did you see the speech at the UN yesterday?
No, I
No,
didn't.
no.
Oh,
Can
you
you
guys should
No.
see
recap
that.
for us?
The freshman at Yale was wearing of an N95 mask, saying that we're ruining her generation's lives because we're not mandating masking for everybody and putting them all at risk. Um,
Hello.
I won't use her name because I was embarrassed for her, but um, it was Greta Thunberg 2.0.
Oh,
Oh my goodness. Amazing. So
so what did
today,
people say? Did people
I
tell
don't know
her?
what they said. I mean, I was sent the video and I just couldn't believe 2025. We're having to hear that again.
I know the propaganda is sunk in deep, which is really scary, but I always consider this at least it's a mark for me. I avoid these people. I could just not get close to them because who knows what else they think that isn't true. So we were going to talk about thyroid and iodine. I contacted you not too long ago because Dr. Mercola had Al Christensen on his program, and um, Al was saying that we need to deplete iodine in the case of Hashimoto's, and that iodine was toxic. And I think there's this underlying fear of iodine. Now, your book is amazing. I recommend it all the time. But I just had a client last week who I recommended iodine to her, and I asked if she'd been using it already. And she said, no, she said, I find there's controversy around it, so I have avoided it. And I think there's some of this. I would love for you to address this a little more. Iodine is not something to be feared.
Well, at my office in West Bloomfield, Michigan, there's no controversy. We've been treating autoimmune thyroid disorders for over 2 decades, and iodine's the mainstay for that treatment. Iodine was the treatment of choice for autoimmune thyroid disorders a couple of generations of clinicians ago, and it fell out of favor with the use of radioactive iodine to destroy the thyroid gland, and pretty much conventional medicine still utilizes that today as a treatment of choice for autoimmune and thyroid cancer. Um, However, really, radioactive iodine if it is the I guess I could consider it a treatment of choice if you know if it's the underlying cause of these thyroid diseases are a lack of radioactive iodine, then I guess that's the treatment of choice. But that's silly and that's not true. Um, it's iodine deficiency that sets the stage for autoimmune thyroid disease. Well, it's the iodine continuum. I talk about it when I lecture to doctors. I'm looking for a pen. Um, if one of iodine's main jobs in the body is to maintain a normal architecture of the glandular tissue, and the glands include the thyroid, ovaries, uterus, breast, prostate, and pancreas. And if we have enough iodine, we have normal architecture. We don't have growths. We don't have abnormalities. It's normal. And I'll signify normal by this pen. In iodine deficiency, the first thing that starts to happen in these tissues is you get cyst formation. If it goes on longer, the cysts become hard and nodular. If it goes on longer, they take a hyperplastic appearance, and cancer is the end of that road. And autoimmune thyroid disease is somewhere in the middle of this continuum. Um, the animal, test tube, and human studies have shown iodine being able to halt and reverse these illnesses. Now, for Dr. Christensen, I've thrown this out before that the counter argument to iodine causing the autoimmune thyroid epidemic that we're seeing today is easily dispelled by noting that over the last 50 years, according to the N. Haynes study, the National Health and Nutrition Examination Survey done by the U.S. government about every 8 to 10 years, iodine levels have fallen over 50% across the United States. Over that time period, all thyroid disorders, autoimmune thyroid disorders, hypothyroidism, and thyroid cancer have increased at epidemic rates. That is that what I just described illustrates a negative association with iodine and iodine causing hypothyroidism, iodine causing autoimmune thyroid disease, and iodine causing thyroid cancer. That disproves iodine as the cause of those illnesses. Now, it doesn't mean to say that there's other causes of them. Maybe it's not iodine deficiency, but I can tell you in my practice, we have case after case after case of autoimmune thyroid disease, even thyroid cancer, and certainly hypothyroidism, being resolved with the use of iodine. To dispel any hypothesis, all you need is an N of 1 that shows the opposite. And I got many N's in my practice, but I got an N of 2 and 2 daughters who both were diagnosed with Hashimoto's disease at 10 and 11 years old. And I have their labs, and I show what I did with them, gradually increasing their iodine. You can see the titers, which were in the thousands to start, or the upper hundreds on one of them, the thousands in the other one, coming down to 0 now. And they're 30 and 31, and no signs of Hashimoto's on either of them. So there's an N of 2 to dispel that myth. And we have many more patients showing that.
I just had a conversation with Jeffrey Dash, who has his a natural thyroid toolkit book. And one of the things he mentioned was that if you have Hashimoto's and you give thyroid first and TSH is lowered, then whatever perceived sensitivity to iodine before just disappears and you're free to use it. Have you noticed any such thing? Do you also use thyroid with Hashimoto's when you're treating?
So the first 10 years of my practice, I did not use iodine. My holistic practice, which I've been in practice about 35 years now. I didn't use iodine. I didn't know about it. I didn't understand it, and I was fearful of it. And I wrote at that time, and it comes back to bite me every once in a while because it's on the internet. Using iodine in the case of a autoimmune thyroid patient is like pouring gas on the fire. That was an ignorant comment. That was a comment of someone who was iodophobic at the time and didn't understand. I was iodine illiterate at the time. Now, In the first 10 years of my holistic practice, I was diagnosing a lot of people with hypothyroidism and putting a lot of people on desiccated natural thyroid hormone. Patients were getting better. My practice was growing. Patients reported feeling better. I thought I was doing a service to them, and things were well. But it was starting to bother me why I was having to use so much thyroid hormone on so many people to make them feel better. I didn't think we were designed by our maker for everyone to have to use natural thyroid hormone to feel good just because they're getting a little bit older or they're adults now. And I was using it on kids as well. But so in my holistic practice, I study biochemistry and physiology a lot. And I look at my biochem books and I look at the biochemistry of whatever I'm working on in the body. And if I'm going to talk about thyroid or study thyroid, I want to look at the biochemistry of how the thyroid gland makes thyroid hormone. And when you study that, the thyroid gland needs certain key ingredients to make thyroid hormone. It needs magnesium, it needs B vitamins, it needs vitamin C, it needs selenium, and it needs iodine to make thyroid hormone. So over those first 10 years, when I realized I thought I was putting too many people on thyroid hormone, even though my testing indicated they needed it, I would try these various cofactors, but nothing worked as well as thyroid hormone. And most of the cofactors didn't make anyone feel any better. They couldn't tell the difference. And I was checking blood, serum, and hair levels of these things. And I would come back to, I would try iodine. I would try little amounts, medium amounts, large amounts. Nothing worked. And I would go back to putting them on thyroid hormone. During this first 10-year period, there were 2 articles that came up by Bernard Eskin. Bernard Eskin wrote 2 articles concluding that women who took thyroid hormone, and they were on Synthroid because that's what he used in his practice. He didn't specify it, but I'm assuming he meant Synthroid or Levothyroid. Women who took thyroid hormone compared to women who didn't take thyroid hormone had I believe, a 50% increased risk of breast cancer. Period.
I saw that. Yeah.
Eskin put out a second study shortly after 10 years compared to women who didn't take thyroid hormone had a larger increase of breast cancer. So I saw these 2 studies come out. They were in the later part of the first 10 years of my practice. And I consider myself pretty good at reading medical studies, pretty good at looking at the statistical analyses and the the methodologies of how they do studies. And I couldn't come up with much to criticize these studies with. They were pretty straightforward, pretty easy to perform and pretty easy to understand. And I didn't think anything was untoward about the studies. And if his studies were pointing to the truth, then here I was putting people on thyroid hormone, and am I increasing the risk of breast cancer? Now, we think about breast cancer. 1 in 7 women in the United States have a lifetime history of getting breast cancer. Number's been going up for years. The fibrocystic breast disease currently affects over 80% of women. We know that's a precursor to breast cancer, just as I talked to you about with iodine, cysts, nodules, hyperplasia, cancer. And so I saw those 2 studies. I would try iodine, and it wasn't working, and I was frustrated with it. Iodine's a very complex molecule. Not many people really understand it, and I was one of them at that time. I would consider myself iodine illiterate. That's why I have that quote that's out there. And then around year 10, in one of my journals, Dr. Guy Abraham, Corrine, you mentioned Abraham Hoffer. It's Guy Abraham who was the.
Guy.
Okay.
Oh,
So
sorry.
Dr. Guy Abraham wrote a little letter to the editor saying he developed an iodine test. That's it. It was 2 or 3 paragraphs long. I saw the letter, and I called him. And Dr. Abraham wasn't very trusting of other doctors at that time. He had some run-ins where he felt other doctors had stolen some of his materials and claimed them for their own glory, and he was very rough on me at the beginning. When I called him up, I said, "I'm interested in your test," and he was very cold, and as I took a lot of pain on the first few phone calls till he got to know me and realized I wasn't going to screw him over.
Mhm.
Um, but he quickly became interested in my practice because of where it was located. I'm in Michigan, southwestern Michigan, southeastern Michigan, outside of Detroit. And as you mentioned in your opening, I'm in the Border Belt of the United States. The Border Belt is the areas that surround the Great Lakes, Wisconsin, Indiana, Illinois, Michigan, and that state down south and east to me, starts with a lowercase o, ends with a lowercase o. And we've beaten them 4 years in a row in football. Me, Buckeye
I'm
Bear,
getting there right here.
4-0. Number 5 is coming soon. And I am wearing my undefeated reigning national champion T-shirt here, just for the Ohio people. So all the states that surround the Great Lakes and into Canada that surround the Great Lakes is known as the Gordy Belt. The soil is one of the most iodine deficient areas in the world. It's been known for over 100 years. So Dr. Abraham was interested just because of where I resided. And he said to me, your patients have to be low in iodine. And I said, I know they have to be low in iodine, but I keep trying it. It's not working. And so he said, let's test your patients. So I flew out to California, met him. He introduced me to bench laboratory work, which I never liked. And I began flying out to California 4 to 6 times a year, spending long weekends with him, 10 to 12 hours a day in that lab, learning about iodine, testing iodine, developing protocols with iodine. And Dr. Abraham, who was, and he's passed on, but I'll still consider him my, mentor in iodine. He's the smartest, one of the smartest doctors I've ever met in my life, and he showed me why I was using the wrong kind of iodine, which I was using iodide, DIDE, the reduced form of iodine only, because it
Mhm.
was a prescription item. I could write a prescription for it.
Yep.
And
SSKI.
SSKI,
Uh-huh.
and it didn't work. It
Yeah.
didn't work.
Whoa.
It didn't make people worse. It didn't make people better. Small, medium, large amounts just didn't work. So he taught me that there's different receptors, different tissues of the body have different receptors for iodine. Some preferentially take up iodide, the reduced form, DIDE. Some
Mhm.
take up iodine, the oxidized form, INE. Reduced and oxidized, if you don't remember from high school chemistry, if you haven't had it since then, fancy terms for meaning whether the outer shell of iodine has its full complement of electrons or not. And the full complement of electrons is the reduced form. Lacking one electron is the oxidized form. Doesn't really matter that much, but what matters for people to remember is the thyroid gland preferentially takes up iodide, while the breasts take up iodine. Now, I was using iodide, the reduced form. You would think that the thyroid tissue, that should
Yep.
work for the thyroid. It didn't work until I had iodine as part of that. So I started testing patients. I wrote about this in my book, my iodine book, and we tested hundreds of people. They were all low on iodine. I mean, it was over 97% were low on iodine, most significantly low on iodine. Between me and my partners now, we're well over 8,000 patients tested. And the numbers hold true. It's over 97% low on iodine. And the numbers have changed a little bit lately because people have seen me lecture or seen a podcast or read my book. They come in sometimes taking iodine. Those ones aren't low. Everybody else is low. So, so I started using iodine around year 10 of my practice, through the mentorship of Dr. Abraham. And all of a sudden, I found out what I call the rule of thirds. The rule of thirds means if you're taking thyroid hormone and you know, not on iodine, and I give you iodine, the rule of thirds comes into play, meaning a third of the population will find they didn't need the thyroid hormone, they just needed iodine. A third of the population will find they need half the dose of thyroid hormone, and a third of the population will need the same dose, and the iodine makes them feel better. And the iodine generally makes all the groups feel better. But the problem is I don't know who those thirds are once I start them on iodine, so I have to, counsel people just, how we're going to adjust this dosing. But either way, what happened was, the first 10 years of my practice, I would estimate 75% of my practice was on thyroid hormone, natural desiccated thyroid hormone. And today, less than 25% of my practice is on natural desiccated thyroid hormone. And that's through the use of iodine. Um, if,
Very
if the government came
interesting.
to me, one last thing, and then I'll take a breath.
Hmm.
If the government came to my office, which they did, If they come to my office flashing badges and making a scene in front of the patients in the waiting room, which they did, and if they demand to come to observe and document what we're doing in our office right then and there, which they did, um, and they conclude after that which they didn't do this, but if they conclude after that you have to give up holistic medicine or you can't practice medicine anymore, but we'll let you take one piece of it with you. You pick. You can keep doing that one piece. The rest you have to go back to conventional medicine. The answer is easy for me. I take iodine. It's inexpensive. It helps the whole body. Every cell in the body needs and requires iodine. I believe iodine deficiency is the major reason why we're seeing the rapid increases of cancer of the glandular tissue. Thyroid is the fastest growing cancer in the United States. Breast cancer, 1 in 7 women have a lifetime risk of breast cancer. Prostate cancer, 1 in 3 men, the same lifetime risk. We have ovarian cancer, uterine cancer growing at epidemic rates. We all know people with pancreatic cancer. In my younger days of training, the only people I saw with pancreatic cancer were old alcoholics or hepatitis patients who were using drugs or things like that. You didn't see previously healthy people all of a sudden coming down with pancreatic cancer, and not young people coming down with pancreatic cancer like we're seeing now. So I think all these conditions are related to iodine deficiency. Do I think iodine's the sole cause of these health problems? No, but I think it's a major cause of these health problems.
I went to a doctor's office, a very well known holistic doctor, and he had his prescription pad with printed on the prescription pad Armor Thyroid. And everybody that walked in there got the script of he'd write the dose and the number and give it out. It was so prominent. Just about everybody was given thyroid hormone. And so it, that you don't need it any longer in the same way is really quite surprising. But can you explain to us how thyroid or iodine is essential for more than just the thyroid, for other body parts?
I will.
Thank you.
Let me pull a political stunt here and just talk
Okay.
about what I want to talk about for 1 second, Rich.
Good.
Um,
I do
so
that also.
let me go back to that. You're going to ask the question in just a second, but let me go back to the studies by Eskin. So recall that those two studies came out in the first 10 years saying if you took thyroid hormone versus not taking thyroid hormone, the risk of thyroid cancer was
Mhm.
increased by, I don't remember,
Breast
30%
cancer.
or
Breast
something.
cancer. Yep.
Yeah, breast cancer.
Yep.
And if you took thyroid hormone for over 10 years, the risk went up further to 50%, so, around those numbers. Now, once I started to use iodine, I realized what Eskin was talking about. And what I tell when I lecture to other doctors, I tell them that when you put someone on thyroid hormone who's iodine deficient, you're going to increase the metabolic rate of the body. Since every cell needs and requires iodine, you're going to make iodine deficiency worse. So tissues that actually depend on iodine, like the glandular tissue, are going to suffer the most. And that's why Eskin found that increased risk of breast cancer. And the longer women
Interesting.
took thyroid hormone, or the women who were on thyroid hormone versus women who weren't on thyroid hormone.
So you're
And
activating the cells and
so
aggravating the
iodine needs to be
deficiency.
used. Iodine in a perfect world, and I do this now. I didn't do this the first 10 years because I didn't know about it. But in a perfect world, in a hypothyroid patient or Hashimoto's patient or whatever, iodine levels should be assessed first. Iodine, if it's low, should be repleted, and then reassess the thyroid function at that time before using thyroid hormone. And that's pretty much how I function now. That closes out that story I wanted to say.
Okay. I
Corinne,
want I want to tell the audience that I don't think we're going to go to the audience. Usually we go to questions. I don't think we're going to go to them directly because what you have to say, I just want to keep on listening and learning and sharing this with our listeners. But you can get a question in because we are right now live streaming on YouTube. And so you can get a question, and by typing in a question, and it will come to us and we'll be able to answer it. So the channel is Take Charge of Your Health Radio. You type that into YouTube and you'll be able to watch this interview. And it's really quite fun. Feel free to
We're getting high
type as a
high tech.
question.
We're getting
I
high tech.
know.
Oh,
We really
Uh,
are. It's really fun.
Dr. Brownstein, let me give you a synopsis of what I do with my clients and let me know what you think. So I will see somebody and they'll have some markers on their thyroid tests, and of course their temperature is low, usually in the 97s instead of in the 98s. And they're also low in other hormones. So I tend to make sure that they have pregnenolone on board, progesterone on board, which according to Dr. Pete were thyroid supportive. And then also from the other end, iodine with the Lugol solution and then selenium 200 micrograms. And what I say is, let's see if the support for the thyroid will actually cause your temperature to go up. And it's not your thyroid that's under functioning, it just doesn't have the support of other hormones and, of course, iodine. What do you think?
I think that monitoring temperatures is an appropriate way to get, one aspect of how the thyroid and adrenals, because the temperature can be,
Hmm.
there's other things that can cause low temperature, but I think it's a great way to monitor things. And I think that, iodine and its other cofactors can certainly increase the metabolic rate or supply the right nutrients for the thyroid to maintain a proper metabolic rate, which can be reflected in a body temperature.
Yep, so that's what I usually watch. I was surprised when I did a little deeper dive on methylation. We're talking about it's becoming more prominent that people have some sort of underperforming methylation detoxification. But I also read that it's an important step for T4 to T3 conversion. Do you see that?
Yes,
Yes.
absolutely. T4 is the inactive form of thyroid hormone. T3 is the active form of thyroid hormone. And um, I have a whole chapter on that in my thyroid book about, poor T4 converters. And all the cofactors help with that, and eating a good diet helps with that. Eating a poor diet, causes problems with that, and mercury and lead and toxins all inhibit that conversion and can inhibit the deiodinase enzyme, which is responsible for taking T4, which is four atoms of iodine attached to thyroglobulin, into T3 and removing one of them.
Now, what about what is there? Are there blockers? I This is a rhetorical question, but there are blockers for iodine to get into the cell. One of them is bromide, and and that's a very important piece because it's in all of our wheat. So, can you explain that too?
So iodine is part of the halide family. And the halide, if you recall from chemistry, in the periodic table of all the elements known to man, the halides are group 17 on the right side of the pathway. And the periodic table of elements is grouped into similarities. And the halides have a similar structure and similar shape. The halides in order of their size are fluoride, chloride, bromide, and iodine. Each of those halides can competitively inhibit one another, meaning too much of one can push out another one. Now, of those four halides, there is a fifth halide, but that's not really relevant to the human body. But of those four halides, two are essential that we can't live without. That's chloride, it's part of salt, sodium chloride, and iodine. Every cell in the body needs and requires both of those halides. Can't function without it, can't live without it. The other two, fluoride and bromide, are non essential toxic elements that not only competitively inhibit iodine, but can mess up the what's called the sodium iodine symporter, which is a little taxi cab that's able to take iodine from the bloodstream and move it into the glands where it's supposed to be concentrated. And it's an energy dependent process to do this. And if you take iodine, you're going to need two sodium molecules to usher iodine into the thyroid gland or the breasts or the ovaries or the uterus or the pancreas or wherever it's supposed to go. And therefore, if you're going to take iodine, you should ensure that you have adequate salt. And using an
Exactly.
unrefined salt like like Selena's Celtic brand salt or Redmond's real salt, um, can supply most of those trace minerals the thyroid will need, and enough sodium molecules that you get, sodium atoms that you can transport through the sodium iodine symporter iodine to where it needs to go. If you don't have enough salt, the body's not going to be able to utilize iodine as well. So I always utilize
Very
iodine with salt.
interesting.
I've written a book with salt, Salt Your Way to Health. I wrote that
Hmm.
book right after I wrote the iodine book because they go hand in hand with one another.
Yes, so many people try avoid salt and are afraid of iodine.
Salt is
This-
second major constituent in the human body next to water. We need adequate amounts of salt. The vast majority of people are deficient in salt. I see it every day in chemistries, every day. And iodine's an essential item needed by every single cell in the body. It's like, I would liken iodine and salt and vitamin C sort of all in the same category. Like they're essential. We can't manufacture them. We should be getting them in on a daily basis.
Is your recommendation still for 2 teaspoons full of salt every day and measure it out, make sure you use it?
Well, a teaspoon or two, yes, teaspoon or two for most people,
Uh-huh.
and get your blood checked by a holistic
Yeah,
doctor who knows how to do this stuff.
the blood
And
chemistries.
if you're active, generally you might need a little bit more. If you sweat or you work out a lot, you're going to need more.
Mhm.
One of the symptoms of salt deficiency is leg cramps or foot cramps. As soon as you get one, I tell my patients a light should go off in your head, like ding, I need more salt.
Yes.
Um, the people that have to be concerned with salt are those suffering with congestive heart failure and those suffering from renal failure. Their bodies, their kidneys, the kidneys in either condition have a difficult time regulating salt. They may not be able to tolerate the levels of salt I'm talking about. For everybody else with normal kidney function, the body can handle an enormous amount of salt, and it needs and requires salt. We don't have stores of these things in our body. We're not camels. We don't have humps for water. We don't have humps for salt. We don't have humps for iodine. So we're utilizing them on a daily basis. This needs to be maintained on a daily basis to achieve optimal health.
We're getting some questions. They're coming in. So, first of all, magnificent regards on the interview. And then it says high estrogen can lower core temperatures for many reasons. Is that not true?
Carol, you can handle that one.
Yeah, it suppresses thyroid. I'm
It
big
does.
time. It does,
Okay.
and as I mentioned before, like I am recommending, a lot of women are low in progesterone. Just being relatively low in progesterone means that estrogen is dominant. You could be in a fairly low absolute numbers for estrogen. Looks like you're low in estrogen, but if your
But if
progesterone's
your
even lower,
progesterone's lower,
you're still estrogen dominant, and that state will suppress your thyroid.
And iodine's needed to metabolize estrogens. So if
That's
you're
right.
deficient in iodine, estrogens become much more toxic.
You need it for that last step to estriol.
Yep.
Absolutely.
okay, we have another question. I nuked my thyroid in 2003. I went on Synthroid, used it faithfully for 5 years. I pretty much quit it cold turkey. I'm wondering if I should start iodine, but I'm not really experiencing negative symptoms.
Well, just because you had your thyroid, irradiated or surgically removed, iodine's needed by every single cell in the body. Thyroid has the highest concentration of iodine at saturation about 50 milligrams. The whole body at saturation is around 2 grams or 2,000 milligrams. The skin holds a huge amount of iodine. The muscles hold the number one amount of iodine. The fat holds number two amount of iodine. So if you have skin, if you have muscles, if you have brain, if you have liver, all that needs iodine as well. Just because you don't have a thyroid, that's a minuscule amount of the body load of iodine at saturation.
Then the next question, thank you. The next question is how about Brazil nuts for selenium?
Yeah,
Selenium.
for selenium, I'm not sure Brazil nuts are high in iodine. I don't recall that.
I don't think they are.
Uh-huh. But as a cofactor.
Yep.
Yeah,
So so
that was
what
good.
yes, it's wonderful. I love it. I love getting the questions. They're good ones. Thank you. Keep them coming.
I
So
have it. I have another question. Do you monitor reverse T3, and could you explain it for our audience?
Now, reverse T3. There's a whole chapter in my thyroid book on reverse T3 because I call reverse T3 the King Solomon of thyroid tests. And what I mean by that is,
Oh,
um, there are many patients when you do a thyroid. In med school, I was taught to do a TSH level, and that was it. If the
Mhm.
thyroid stimulating hormone, it's a hormone that comes from the pituitary gland in your brain. It's produced to stimulate the thyroid gland to make thyroid hormone, and then when thyroid hormone feeds back into the brain assesses whether it's too little or too much. If it's too little, TSH will go up. If it's too much, TSH will go down. That's how it's supposed to work. I wasn't. I was taught that was enough. Um, they've changed a little bit now. What they do is they suggest checking a TSH and a T4 level. Um, but that's it. That's all they check
Mhm.
are inactive thyroid hormone levels and TSH levels now. And they'll tell you whether your thyroid is properly functioning or not. That's a really poor man's way of doing it. And you're missing so many data points by just checking that. And you're going to miss too many people with thyroid problems. You know, in med school, the way I was taught and the way it's taught today, and I can assess, I can make that statement with some authority because I have two girls who finished med school much recently, and they were taught the same thing I was taught, except adding a T4 to the levels. But the way I was taught was you didn't have to talk to a patient, touch a patient, listen to a patient. Basically, just draw the blood work. If it's abnormal, give them a prescription for thyroid hormone. If it's normal, give them a prescription for antidepressants or whatever their complaints are. And that's not a great way to practice medicine. Unfortunately, that's how conventional medicine still operates today. So I am totally in the weeds because I forgot what the question was. But what I do now,
Reverse T3.
reverse T3. So when assessing the thyroid gland, I do a history, I do a physical exam, and I teach doctors how to palpate the thyroid because that's most doctors don't know how to do that anymore, and they've lost their palpatory skills. Um, and then I do laboratory work. And a proper thyroid assessment laboratory wise is checking a TSH level, is checking a free T4 level, is checking a free T3 level, and checking reverse T3 and thyroid antibodies. Then you can get a much larger picture of what's going on with the thyroid gland. Now, reverse T3, as I said earlier, I consider that the King Solomon of thyroid tests because when there's discrepancies, sometimes you'll see thyroid levels come back and a couple tests will say they need more thyroid, couple say they need less thyroid. The hell do you do with that? You're getting
Mhm.
some saying this, some saying this. And, um, you know, so when I teach doctors this, I teach them how to assess reverse T3. Most have never even learned it or known what it is. There are still today some labs who won't do reverse T3 levels in my area. It drives me nuts.
mhm.
Yeah.
And it's the most important thyroid test. Reverse T3 is there
Really?
by our, I think it was designed by our maker to ensure that we don't become hyperthyroid. And it's kind of the brake on thyroid hormone. So when reverse T3 is high, it makes me think, they're hyperthyroid or they're on too much thyroid hormone or something like that. When it's low, the body's calling for more thyroid hormone. In the case of iodine, when reverse T3 is high, it's 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 a signal. Generally, they need more iodine.
Interesting. I know,
Okay.
and it's not that hard to do that test, as far as I know. If you
Well, if the
should
Oh,
lab
no.
will do it.
get
Well,
people to do it, but
the labs in New York will do it.
well,
It's
that's good.
quite, yeah, it's not a problem. I check it regularly. Whenever I check thyroid, I also check the reverse T3. So, what would be um, some of the common symptoms of hypothyroid?
Hypothyroid.
Uh huh.
So hypothyroid refers to an underproducing thyroid gland.
Mm-hmm.
So the thyroid receptors throughout our body are not getting enough thyroid hormone. And thyroid hormone's main job in every cell in the body is to increase the metabolic rate of the cell. And if you think about it like a machine, you increase the metabolic rate, this machine's going to produce enough heat to keep us warm in the wintertime or warm when it's cold outside of the environment's cold. And um, people with hypothyroidism have a hard time doing that because their machinery is so sluggish They're not producing enough heat, and they're cold. They're cold in the summertime. They're colder in the wintertime. Um, and um, so so the symptoms of hypothyroidism are general sense of coldness, particularly cold hands, cold feet. They get dry skin. They get the hair that's become lifeless and can fall out. It falls out from the front here and then moves
Yeah.
backwards. Their eyebrows can thin out from the outer to the inner part, and you'll start losing their eyebrows. They can have swelling under the eyes called periorbital edema. Um, I can usually assess someone really quick just looking at their face and their thyroid function. And my one of my stories with this was, my kids when they were little, they used to come to my lectures and they like to sell books. It was people come collect the money and make the change and all that. And the kids were good at that. So they saw my lecture multiple times, and I show pictures of people in my lecture of hypothyroid faces. And so we went. I remember the movie theater. Went to the movie theater, the Star movie theater by us. I don't know what we saw, and I'm paying the ticket. I'm paying the lady behind the window for the ticket. We leave, and I'm holding both hands as we're walking away. And one of my daughters says, "Dad, she looks like one of those pictures you show in your lecture. She's hypothyroid. Why don't you talk to her?" And I said, "We'll catch you later." On the way out. On the way out. And so so those are some of the signs of hypothyroid. Lack of energy, weight gain, unexpected weight gain, and a sense of puffiness, like the Pillsbury Doughboy. They get this myxodematous fluid underneath their skin, where they feel squishy, and patients will tell you they feel puffy. They know something's wrong. They can have a swollen tongue, and I look at people's tongues all the time and diagnose many hypothyroid patients just looking at a tongue and saying, "Does your tongue feel too big for your mouth?" And they'll look at you, quizzically, "How'd you know?" And because you could see the teeth marks in the side of their tongue.
Yeah, you get little scallops on the
They're
Exactly.
through your
big,
teeth.
they're just bumping into the
Scalloping.
teeth, and they're tripping over their tongue, when they talk a lot of times. So those are some of the signs. Um, there's many others, that
Constipation's a big one.
Oh,
yes, it is.
what would be a comfortable amount of iodine for people to take? I you through working and talking with you, I recommend Lugol's, and when was it created? Lugol's solution, Lugol's iodine.
Dr. Lugol created Lugol's solution in 1820s, I believe.
Oh my
And
goodness.
it was the most used medical item up until patent medicine took hold after World War II. And it was the most used medical item because the most common killer back then was infectious diseases, and iodine has anti-infectious properties to it. Iodine is still used in surgeries to prep the skin because it kills all
Yeah,
viruses, bacteria,
betadine.
parasites. There's nothing resistant to iodine, and
Mm-hmm.
Lugol's can still be painted on the skin to prevent infection. And you can take iodine orally when you have infections. Take more of it. So, you know, everyone's a unique biochemical individual and should be treated as such, and everyone deserves their own individual workup to see what levels of these nutrients they need. Having said that, as a general, my average dose is probably 25 milligrams for an average adult person. Um,
25 milligrams.
25 milligrams. And if they
Because
have glandular disease, more.
more. Because a standard dose that you'll see on vitamin pills is 150 micrograms.
150 micrograms is the RDA for iodine. That's the perfect amount for a little rat. It protects rats against getting breast cancer and thyroid cancer, and that's fine for the rats. That's not fine for the rest of us.
Hmm. So you would recommend that people listening to the show explore that larger amount, or
I'd recommend them finding a good holistic doctor who is iodine literate and um, and who understands iodine and who understands the negative association between falling iodine levels over the last 50 years and rising cases
Mhm.
of hypothyroidism, autoimmune thyroid disease, and thyroid cancer, as well as breast cancer, prostate cancer, pancreatic cancer, ovarian cancer, uterine cancer, and so on and so on.
I remember Dr. Teitelbaum told us that if you hear the words thyroid, grab your iodine bottle. Oh, no, I'm sorry. If you hear the words cancer,
Cancer,
grab your
your
iodine
iodine
bottle.
bottle.
But
Yeah, that,
how would we test it?
So iodine can be tested through saliva, serum, and urine. Urine is really the easiest way to do it. And um, Dr. Abraham and I did saliva serum ratios, which was really cool. But it's very nobody's doing it now. It's very intensive, and I don't. It was a great test. Um, but the easiest way to do it is urinary iodine excretion test, and Dr. Abraham developed the 24-hour loading test, which can give a lot of information about iodine. And you can do spot urine iodines where you just pee in a cup whenever, and they'll measure how much iodine comes out. Since about 98+% of the iodine taken in orally comes out through the urine, you get a general idea of how much is in the body. Um, the spot urinary iodine test only works if you're iodine deficient. It doesn't work once you're taking iodine, since we don't have reference ranges for that.
Mhm.
Do you also check the other halides when if you would do
So
a 24-hour? Do you recommend that or not?
So we did that, Dr.
Uh-huh.
Abraham and I. We did fluoride and bromide and iodine. Chloride you can't check because chloride's an essential item
Yeah.
that
Yeah.
we need. Um, in my book, I did that study on breast cancer patients where I showed that breast cancer patients um, versus patients who didn't have breast cancer had 50% higher bromide and 50% lower iodine. The breast cancer patients were lower in iodine, higher in bromide than the non-breast cancer patients. And then as I gave them iodine, those breast cancer patients excreted a huge amount of bromide because their body was so loaded with it. And it took them longer to get iodine up to normal levels. Um, Fluoride was a little more difficult. It's a very small, it's the smallest halide. It's a very electronegative substance. It's very toxic to the human body. And the body does not enjoy fluoride floating around because it poisons hundreds of different enzymes in the body. So the body tries to neutralize fluoride quickly and bind it away into our bones. So we couldn't really measure the effect of fluoride and iodine. But we could easily measure bromide and iodine, and I reported that in my iodine book. And, um, you know, as you mentioned earlier, Corinne, bromide is a big problem. Bromide is in food and drink as brominated vegetable oil. The the new um, I'm hoping the new government under the new Health and Human Services under RFKJ will eliminate bromide in food and drink. And it's still
Well,
there now.
it's
Yeah,
not
there's some
even
talk about
necessary.
that.
They don't use it in Europe. They don't use it as
It's
a
used. It's also
surfactant.
used as a fire retardant all through the U.S. in carpet and curtains and
It's everywhere.
mattresses
So
and
guess
everywhere,
what,
iPhones. So the number one toxicity we found in our testing was bromide by far.
Dr. Brownstein? This is the saddest point of the show.
Go
I,
on.
we have to say we have to end. Can I get your website, please? So
Website is
those
www.brownstein.com. We're in West Bloomfield, Michigan. We have 8 practitioners,
2 of them
7 practitioners.
are your daughters.
2 are my daughters. I'm having the
Daughters.
best
Oh,
time of my life.
no wonder you look so wonderful. You look so healthy. You're glowing.
Yeah, keep talking. Everyone asks me now that my kids are there, you're going to retire, right? And I'm like, why would I retire? I'm having more fun. I'm
Fun.
not retiring. Um,
And do you have a newsletter that can you
And
hook up to the newsletter on your website?
I have a newsletter. It's from Newsmax. I write a health newsletter for them every month. I've been doing that for 18 years. That's on my website. It's on newsmax.com. If you type in my name in Newsmax, it'll pop up. And I'm having the best time of my life practicing right now. It's an honor.
it's showing.
Yeah.
So, Carol, quickly, your website.
Quickly, my
Very
website
quickly,
is
seconds.
the Wellness by Design Project, and then we are on Facebook. Take Charge of Your Health with Corrine and Carol, and some of you have found us on YouTube. Take Charge of Your Health Radio. So please continue to check in with us. We are so grateful to have you today, Dr. Brownstein. Thank you so much for taking this time with us.
Thank you
Thank
for having
you.
me, ladies.
Thank you so much. And don't be a stranger.
Yes.
You too.
We want you more often. And
All
my
right, do it.
website is Corrine Health and CORINNE health.com. And both of our websites have newsletters and blogs, very good information. My goodness, between the three of us that you're watching, there is so much information. You will become experts. Thank you
Thank
again.
Thank you.
Bye.